Hi, this is Dr. Bob Dannenhoffer from the Public Health Office from Douglas County with another of our Facebook Live events. Today is August the 17th. We've done about 150 of these, and I will tell you today is the most dire of all the times we've done this. So during this entire pandemic, we've seen ups and downs and positives and negatives, but I will tell you today it is about as dire as it gets. But this isn't to spread dire news, but really to answer your questions. So please put them in. We already have 16 questions on Facebook, at Facebook Live, Facebook questions at douglaspublichealthnetwork.org, and we'll get to those first. But if you have other questions, please put them in the chat section. The chat section last week got a little ugly with people sending in comments about other commentators. We don't do that. If you have questions for me or you want to say I'm stupid, that's okay, but please don't denigrate other writers in there. So as always, we start at the world view and then move down. In the world, we're seeing very high case counts, especially in the US, the UK, parts of Asia that have not had a lot of disease before, like Indonesia, Malaysia, and Thailand. We're still seeing a lot of disease in Africa, and it's concerning because it's now moving to Central Africa, where some of the most dense populations live. South America actually is getting better. So South America, which has really struggled with this for months and months and months, is finally starting to get better. I think maybe as they're now starting to warm up from their winter weather, they're getting better. It's still low in some places. New Zealand, Australia, Taiwan, South Korea all have extremely low rates of disease, less than one case per 100,000 per day, which is really amazing. U.S. is very active. Remember, you've been watching, it started about 6 weeks ago in Missouri, of all places, and now has moved its way down through Arkansas, and now Louisiana, Mississippi, Texas, and Florida are really struggling with incredibly high rates of disease. The only good news looking at that is that Missouri and Arkansas, which started this about 6 or 8 weeks ago, seem to have topped out. Not getting better, but they've topped out at their amount of disease and maybe starting to come down now, suggesting that these spikes, when they occur, won't last forever, but they really had a really tough time for 6 or 8 weeks. And right now, Louisiana, Mississippi, and Florida are really struggling with incredibly high levels of disease and high levels of hospitalization, which is really straining the hospital system in those states. But we're also starting to see disease in other unusual places that have not had a lot of disease before, especially Wyoming, Hawaii, and Oregon. 3 places that have a lot of disease in the past, now having some of their highest hospitalization rates ever. Oregon is very interesting. We reported 2,900 cases today, but it's been really spotty. There's really not very much disease in Multnomah County, Hood River County, Washington County, and Clackamas County. So those areas that had a lot of disease early in the pandemic because they're more crowded, now are having very low levels of disease, maybe because they have very high levels of vaccination. But we are seeing an absolute explosion of cases in Josephine, Jackson, Curry, Umatilla, and sadly, Douglas County. So every day I look at the top 100 counties in the country, and Oregon has been there very much, but today both Curry and Josephine are there, and I think tomorrow likely Douglas will be there. Douglas County, it's absolutely dreadful. Depending on who you look, we've reported somewhere between 260 and 300 cases in a single day. So the OHA does their reporting in a little bit different time frames, but we reported 261, the OHA reported 300, and they just keep coming. And they keep coming in huge batches where an employer will come, we have 20 people testing positive, and so it really is all throughout town. It's mostly in workplaces, but it's also in households. It's also in groups like groups who were at the fair or groups who were in sports. So it is really spreading. You remember back a few weeks ago, 20 or 30 cases in a day was a lot. To have 260 or 300 cases in a day is just breathtaking. And what is most worrisome about this is that many people who get COVID will get over and get fine, but about 8% of the people who get it will get hospitalized. And this 8% number of people who get it and get hospitalized has been just about the same number all along. It's maybe a little scarier now because the people are younger, but about 8% of the people get hospitalized about 8 days after they get the illness. And so you can kind of predict what's going to happen. So we've been predicting the number of hospitalizations. 62 today. So 62 Douglas County residents hospitalized. And it looks like over the next few weeks that's going to continue to rise because all of these 200 some odd people who had disease today are going to get sick in a while in 8 days. And when they do, they're going to seek hospital care. I think there were 16 admissions over the last 2 days. That is just a stunning number of new admissions to the hospital for COVID. And the hospital system is really, really struggling. Oregon is divided into hospital regions. Region 7, which is Bend and much of Eastern Oregon, no ICU beds available. Jackson County, 1 bed available. Our region, which is Douglas, Lane, Coos and Curry, just a few beds available. And that's the worry because we are not nearly at the end of this hospital spike. This is going to increase. And the worry is that the hospital will just be overloaded and it can't take any new patients. So if you want to find out the specifics, Jason Gray is going to be on the radio tomorrow, and he'll be talking about what Mercy is doing, but they've stopped elective surgeries. They've made a lot of changes in staffing. Nurses are taking more patients. People who are working in the hospital are doing jobs that they don't necessarily do just because they need to cover for all these people. There were 10 people on ventilators. Usually I worked there for years. 2, 3, 4, 5 people on a ventilator. They have 10 now, and then a bunch of people on other really intensive things. So we really, really, really are in a really bad way. And the worry is that we're not at the worst of it. Every day when I see the number of cases goes up, and when I saw 160 over the last few days, I was hoping that would be our peak. But then to see the numbers today is just so disheartening. And a lot of people, 9 people have died, and of those people who died, one was a 27-year-old. I mean, my kids are 27 years old. I can't imagine them dying for any reason, much less dying of COVID. And we have other 20-year-olds on ventilators in the hospital. This week, 2 people who I knew, people younger than me, still long lives ahead of them, young, healthy people, are now dead. And they're not going to get a chance to enjoy their retirement or their kids. And for the most part, our cases and our hospitalizations are almost all unvaccinated. So when we looked last week, we had 917 cases over the week we looked. 68 of those were vaccinated. So those were 68 breakthroughs, but 849 were unvaccinated. And when you look at the number of adults who are vaccinated and unvaccinated, we're just about 50-50. So to have 68 vaccinated, 849 unvaccinated, doesn't take a statistical genius to recognize that, whoa, the unvaccinated are tremendously overcounted. When we looked earlier the week on hospitalizations, there were 56 in the hospital. 51 of the 56 were unvaccinated. Only 5 in the hospital were vaccinated. And the vaccines are great. They're not perfect. They're about 85% good at preventing illness, about 90 or better at preventing hospitalizations. But people say, I don't need to get it because it's not perfect. Well, there's nothing we do in life which is perfect. Airbags, seat belts, bulletproof vests, none of those things are perfect, but we use them because they're pretty good at preventing adverse outcomes. So it really is worrisome. Anyway, we've got a lot of questions, so let's go through those. So please talk about the booster for immune suppressed and the rest of us who are not. So as you know, we've been talking about boosters. I think the CDC is preferring to call it 3rd dose for a while. We do know that immunity wanes a little bit with time, and booster shots help to bring it up. I think the reason they're calling this a 3rd dose rather than a booster is because typically boosters reflect the current circulating virus, and none of the vaccines reflect the current circulating virus. So I think they're calling this a 3rd dose. Last week, they came out with recommendations for those who are immune suppressed, and they described immune suppressed in 3 ways. One is you had advanced HIV. The second was that you had a solid organ transplant like a kidney or a heart, or that you had cancer and wanted chemotherapy. So those were 3 examples they gave, although they gave, I think, a little wiggle room for others who are immune suppressed to get a 3rd dose. The recommendation is to get the 3rd dose of an mRNA vaccine with the Pfizer or the Moderna. It did not say what you should do with the J&J, and that is worrisome. Today there was a press report that they're going to recommend a third dose for all people who got vaccinated 8 months after the second dose of the mRNA. But again, not a lot of guidance about what we do with the J&J. So if you're in one of those immune suppressed conditions, and we think they're probably in Douglas County, maybe 500 of those people, you should talk to your doctor and think about getting a third dose and pay attention for what they recommend for third doses. I hope it comes out in the next week. You know, if you've been watching, I've been saying, look, you guys got to give us some guidance, because in the absence of guidance, people are going to make it up, and they're not going to do, and they're going to make some mistakes. So second question is, do I need to quarantine if I'm vaccinated? So people who are vaccinated are much less likely to get the disease, about 85% less likely to get the disease. And so the point is that you don't have to quarantine. 85% is good, but not perfect. And so we are recommending that if you are vaccinated and a family member has the disease, right, you're continually exposed to them, usually high levels, because it's hard to get away from family members. So we are recommending that people who are vaccinated still quarantine if it's a household contact. Think if it's a work contact or other contacts, you don't have to quarantine, but we would monitor you carefully. So this next question is a hard one. Under current school guidance, if a student is exposed to another student with COVID during lunch with no mask, would they be required to quarantine? And so the current guidance says that if kids are at school and they're distanced and wearing masks, and one kid gets sick, the other kids in the class don't need to quarantine. And that was based on some studies from North Carolina that showed that when kids were distanced and masked, they rarely spread it to other kids. Now, teachers can spread it to kids, and if you don't wear a mask correctly, or you have improper spacing, you can. The question is, what happens if they're at lunch with no mask? Would they be required to quarantine? And there is going to be some further guidance on that to spell it out, right? So you're at lunch with a bunch of kids, you can't have your mask on, you can't eat through your mask. And so the question is, would they be required to quarantine if they were there in 5 minutes, 20 minutes, an hour? So I'm expecting some guidance later this week. So when will the vaccine be available for kids? So it's available for people 12 and above now. We've not seen great uptake among teenagers, but there's some talk about it being available for kids less than 12 sometime this winter. So it's still a good way off. So what are your thoughts on transmission during swimming lessons for kids in school? Well, swimming lessons, if they're done outside, relatively low risk, and chlorine is a good killer of most viruses, including COVID. So swimming lessons are probably one of the safer activities. School, again, if you're distanced and masked, still pretty safe, so it's a problem. So this one is, are you sending out fake letters to drive up your numbers? I saw one post online. So let me tell you what happened. Somebody got tested at a place in town. The place in town, by their error, reported as positive when it was really negative. We then sent a letter to a person saying, we've been told you tested positive for COVID. And they said, no, I didn't. And we rechecked, and yes, it was reported an error. When you have this many cases and the hospital so crowded as it is, and everybody working so hard, we are going to make an occasional error. And occasional errors were made, and that was an error. It was unfortunately sent to somebody who posted it online. So it did it. We're not doing this to drive up the numbers. We're doing it because people who are working incredibly hard, incredibly long hours, made a simple mistake. So someone says, please talk about the current treatments for COVID. It seems like people are all about ivermectin, but I want to know about other treatments. So COVID, sadly, does not have a lot of really good treatments. You know, we were hoping early on that we'd come up with a blockbuster kind of antiviral drug, sort of like the antiviral drugs for hepatitis C. Right? The antiviral drugs for hepatitis C are now great. You know, get hepatitis C in the past is bad disease, hard to get rid of. A lot of people died or had cirrhosis from it. But now with these new drugs, 8 or 12 weeks of treatment, about 98% of the people can be free of hepatitis C forever. It really kills it off. Similarly, with things like herpes, acyclovir works very well, hasn't developed a lot of resistance, and really works very nicely. And for HIV, HIV got turned around not because we have great vaccine for HIV, we don't, but really got turned around because we have very effective antiviral treatments. So we've been hoping for a really effective antiviral treatment for COVID. we don't really have one. There's remdesivir, which was originally developed for other viruses that came out, and they tried it for COVID, and it probably has a tiny difference. And so there is an antiviral called remdesivir. The other one is this Regeneron antibody. So what they did is early on they came up with antibodies, and they produced these antibodies in the laboratory, and then they give it to people. And if you get it, if you're not vaccinated or have bad immune response, like some people with solid organ transplants will, and at high risk, and get this early in the course of disease, it can decrease your chance of being hospitalized by a good amount. And so this regen COVID stuff is pretty good. The problem is it's hard to give. It either needs to be an IV infusion or 4 separate subcutaneous things, and no sense that it prevents death. So in the 1,300 people in the trial, there were no deaths in either group. So obviously, it didn't really seem to prevent deaths. Once you're in the hospital, I think people are treating people with things to prevent clotting, because clotting is a big problem with the disease. And then Decadron, which is a steroid, which reduces the inflammation in the lungs. There are also some arthritis kind of treatments, so things that decrease interleukin-6. And so interleukin-6 is a cytokine, is one of these cytokines that is a messenger that deals with inflammation, and that's one of the reasons you have a lot of inflammation from arthritis. And so some of these treatments can decrease your amount of interleukin-6, and so they're trying those. They probably make a very small difference. Prone positioning, which is when people are sick, you put them on their bellies rather than on their backs, and that seems to help. Then there's a bunch of things that we're not sure about. So hydroxychloroquine was one of the first things that came out. I think there's a lot of good studies that suggest it doesn't work, and very few good studies that suggest it does work. So I don't think hydroxychloroquine makes a lot of sense. There's zinc. So zinc, which is something people take for colds, never been shown to help or not help. But zinc, not dangerous, easy to use. I don't mind if people use zinc. The next one is vitamin D. It's very clear that people with lower vitamin D levels seem to be at more risk for COVID, but a lot of people with low vitamin D levels have low vitamin D levels for other reasons that make them sick. A reasonable study looked at people and looked at all the other factors, and it didn't seem that the low vitamin D levels made a difference. And there was a study where they gave people vitamin D, and it didn't seem to make a difference. But vitamin D is probably good for you anyway, so taking a little bit of vitamin D is perfectly fine. Ivermectin is the one that has the most heat. And since last we talked, there's 3 new things on ivermectin. One is another meta-analysis. So a meta-analysis is where you take all the studies and then you look to see in the end whether it looked like it worked or not. I mean, we use kind of meta stuff all the time. And when you go to Rotten Tomatoes and they have, for looking at movies, and they have like 300 reviews. I don't read all 300 reviews, but if 90% of the people think the movie was good, it probably is good. And actually, I find it pretty accurate. You know, if Rotten Tomatoes gives a good score to a movie, I usually like the movie. If they gave a low score to the movie, I usually don't watch it. But if I do, they were right. So that's sort of what a meta-analysis is with studies. And what you do is you look at all the studies out there and you see whether in the end they suggest it works or it doesn't. There is a meta-analysis out there that's been posted and then removed and posted again, which is very worrisome because it looks like the way they did is they just posted the positive reviews. And in fact, one of the studies that they did was from Egypt, which appears to have been totally bogus. Not ever done at all. It looks like it was just totally made up. And that was where they got a lot of their data from. More recently, another meta-analysis said, no, I'm going to look at all the studies, suggested it didn't work at all. Cochrane, which is this group from the UK, which looks at different things and really takes a pretty harsh look at this, said there's really not enough data to know whether it works or not. There's a few kind of crummy studies out there we don't know. Then there was a study from Israel that suggested that people who got ivermectin had less virus in their nose at 6 days than those who didn't. I don't know if that makes any difference to me. And the difference was small. So the difference was 50% versus 72%. So it wasn't like an enormous difference. And I don't know whether that makes any difference. And then there was a study done in a Canada group from McMaster University that was actually very well done, about 600 on both sides, double-blinded, so neither the investigators nor the patient knew. They looked for a reasonable outcome, which was hospitalization or death, and they found no difference between those who were hospitalized and those who were not, those who got ivermectin and those who did not. So I don't know what to make of ivermectin. I think the data is still not out there, but it's hard to believe it's a miracle. Right? Things that are miracles are really obvious. It doesn't take a bunch of talking heads on YouTube to convince you one way or not. When something's a miracle, it really works. It's not like there was a lot of concern. Geez, I wonder if penicillin works as an antibiotic. It was very clear that it did. So I don't think it's a miracle. Might it have a small effect? I don't know. There are 5 ongoing studies to see, but the fact that we get further and further in there and we have no positive studies makes it seem like it probably doesn't work. There's a thing called fluvoxamine, which is a drug that's used to treat obsessive compulsive disorder. Still no more studies on that. It had a little bit of a couple of little studies that suggested it worked, but I haven't seen anything more on that. So that's what's out there in terms of treatment. Again, it's not very good. And so the best thing to do is prevention. So can you tell us how many of the recent deaths and hospitalizations are breakthrough cases? So again, when we looked the last time, and this is what I said, but what I do at night is, my wife and I look through all the cases and pick out, do a full review of the vaccination status on all of those. And the thing that's remarkable is the Oregon immunization alert system, which has all these vaccines, has most of the people in it. So most of the people who are unvaccinated for COVID got a vaccine some other time, a pneumonia vaccine, a shingles vaccine, a flu vaccine. So they're in there. And again, 56 hospitalizations, 51 of the 56 not vaccinated, 5 of the 56 were. So if everybody was vaccinated, we had 5 or 10 people in the hospital, we could maybe have skipped today's thing. 5 or 10 people in the hospital would not be a crisis. 62, that's a crisis. And then again, we looked at the breakthroughs last week. So 917 cases, 68 of the 68 were breakthroughs, and 849 were not. And so the vaccine efficiency, which you can calculate, was still in the 80s. Of the deaths, almost all of them have been unvaccinated. I believe there was one who was vaccinated. This was an unfortunate person who had both the disease and the vaccine. So you'd think that they should be really well protected, and they weren't, and died. So why is it okay for a kid with a runny nose to wear a mask, but it's okay for adults to take their mask off when they eat at a restaurant? Well, I don't exactly understand the question. I may have read it wrong. You have to take off your mask when you eat at a restaurant. During this time of high transmission, we just want people to be safe. I don't think we need the government to tell us what to do. I think we need to, during this time, be careful. Stay away from crowds. If you're going to be in an indoor situation, wear a mask. If you're sick, please, please, please stay home. I cannot tell you the number of outbreaks we've seen in the last week where they say, oh, Joe's been sick for a week and now he gave it to all of us. Ugh. That is a real problem. And then get vaccinated. So after a positive test, I was told not to retest because it may still show up as a positive. Is it counted more than once? Absolutely not. So if you're positive, any positive you have in the next 90 days is only counted one time. So why would it show up if I'm not contagious? So there are 3 ways to know, 3 different kind of tests. One is called a viral culture. Really hard to do, but far and away the most accurate. And so we have, early on in this disease, We did viral cultures every day on people who were positive, and what we found was viral cultures, which means you can give it to somebody else, never were positive after the 9th day in normal people. Now, if you get hospitalized and you're really sick on a ventilator, it can be longer. If you're immunosuppressed, it can be longer. But for those of us, the rest of us, about 95% of the time, the story is that you after the 9th day, you won't set it anymore, and then you're no longer contagious. There are 2 other kinds of tests. One is an antigen test that looks for the protein. That is usually positive on the 3rd or 4th day of illness, and then stays positive till the 10th to 14th day, and then goes away, because the protein from the disease may still be there for a while, so that usually stays for a while. However, the PCR test, which is the test that looks for mRNA, turns positive early, is really positive in those early days when you're really contagious, and can stay positive for weeks or months, because it's finding the incredibly tiny amounts of RNA that are left after the infection. So the way RNA works is it gets infected, it's in your nose cells. After you've been infected, your nose cells continue to make some of this mRNA for a while, and so that's why it can show up for a long time. We call this dead bugs on the windshield. So you're driving along, there's a lot of bugs there. They're clearly alive while you drive into them, but when you arrive back at home, they're all dead on the windshield. They were clearly bugs at one point. They were clearly alive at one point, and you can look at them and tell they're bugs, but they're not alive anymore. They're dead and stuck to your windshield. So the story is, if you're positive, no need to test again unless you're part of a research study. No reason. If you've not been hospitalized and not immunosuppressed, after 9 days you're no longer, after 9, and we give 1 more day to be safe, after 10 days you're not contagious. If you're hospitalized or immunosuppressed, it's up to 20 days. We're not recommending repeat testing because it just confuses people that why I'm feeling better, I'm back at work, and yet the PCR is positive. And it's because the PCR is such a sensitive test, but we just test it one time. Count it one time. So you can have 10 positive tests, you only get counted one time. So how do you decipher antibodies from the vaccine and antibodies from the natural infection? How long is immunity from both? So antibodies from the natural infection are antibodies against both the S protein, the spike protein, and the N protein, which is not in the vaccine. So if you have antibodies from the vaccine, as do I, you will have anti-S antibodies, but no anti-N antibodies. If you have it from natural infection, you will have both anti-N and anti-S. So the Red Cross does antibody studies on everybody who gets blood drawn, and the first test is looking for spike. If the spike is positive, then they check for N. If the N is positive, then you had natural infection. If the N is negative, then you had antibodies from the vaccine. And how long is immunity from both? So the immunity from natural infection, a couple of studies came out this week, shows that natural immunity is pretty good. It's not quite as good as being vaccinated. And the best kind of immunity is having had the disease and then getting vaccinated. That's the best kind of immunity. So natural immunity is pretty good, but it's not as good as vaccination. But to get natural immunity from having the illness, you actually have to have the illness. And in this case, you risk the infection. You risk long COVID, which is people who have symptoms after 6 weeks. You have people who get hospitalized and die. So yeah, you can get immunity from getting an infection, but it's sort of a nasty way to do it. Again, the best is to get vaccinated. Is the National Guard actually here to help with COVID and too many cases at Mercy? Absolutely. So calling out the National Guard to help out the hospital because there are too many cases at Mercy, yes. And it's too many cases, meaning that some of the people who are working at Mercy are sick because they live in our community and got COVID. And So the National Guard is here to help them. Now, the National Guard who are coming are not for the most part, not medically trained people. So they're going to help out with stuff that nurses might otherwise do. So if you've been in the hospital, worked in the hospital, you know that sometimes the nurses will take somebody down to x-ray, or they'll sometimes clean beds or whatever. In this case, they're going to have the nurses and the specialists do the stuff that only they can do, and then others will be helping out with things that, so the National Guard is here. So when the National Guard has to help the hospital, that's a problem. So about 2 weeks into this pandemic, we have a whiteboard, and we said, what are our goals in this? The first is to prevent mortality. The second is to keep the hospital from getting overwhelmed. The third was to keep the people who are actually taking care of people in the hospital well, and the fourth was to protect protective equipment. And I look at it. We didn't erase it, so it's still there. I look at that, and I realize that our mission has not changed much. That's the problem. So are local hospitals using antibody treatment for patients like they are in Florida? Yes, both Mercy and Evergreen are using the treatments, but again, they're not that great. That there were 1,300 people in the study and it didn't prevent a single death suggests that it's not working. It works a little bit. It certainly works a little bit. It's certainly better than nothing, but it's certainly not great. I mean, far and away, it's better to prevent the disease than to either treat people who have it or to treat people who've been exposed. So what's the thought on boosters for the J&J? I want to know that, right? So we really need to know about the boosters for the J&J. The J&J's actually performed pretty well. All three of the vaccines have performed about the same. So are we opening the COVID unit again at Mercy? Well, they've never closed, right? So they've always had COVID at Mercy. But now what they're doing is they're going to be using some beds in the surgery center, and there are people who are staying in the emergency room for long periods of time. It really is a dire situation. I mean, it really, really is dire. So what happens if all the ICU beds are used with COVID patients and you get in a car wreck, or you get a stroke, or you have a heart attack? I mean, not like you can say, well, they're going to push those COVID patients out and take me. No, they're not going to have an ICU bed for you. Say, well, I'll just go down to Medford or up to Eugene. There are no beds there either. So we're really, really in a tough spot here. I saw a nurse at Mercy say that the OHA report was wrong, exactly wrong on breakthrough. She said that 34 of the 36 people hospitalized were actually vaccinated. That is absolutely not true. I know all of their names. I have looked at every one of their vaccine things, and please have that nurse call me. So as you notice, I haven't gotten very angry. I've been fairly calm on this, but I've heard a few just absolute bald-faced lies this week that really have to be put down. So if this nurse said that, get me their name, and I'll give them a call, and I would have them show me their vaccine cards, because I can actually show you that the overwhelming majority were not vaccinated. The other thing that we heard is the hospital's full of people with vaccine-related injuries. I checked with the intensivists, I checked with Dr. Gray. There's no one there with vaccine-related injury. There's 60 some odd people there with COVID. As best we can tell, there's no one there. So again, all these people say that, I know people were badly injured and hospitalized and whatever from the vaccine. I want to know about it. It does happen, right? So we know with the J&J, about 1 in 100,000 people are going to have this weird clotting reaction. We know with the mRNA vaccines, especially young men, about 1, maybe in 100,000, 1 in 10,000 are going to have this myocarditis. It's usually mild, treated just with over-the-counter ibuprofen, and they get better. And we know those things are going to happen. But this story that the hospital's full of people with vaccine injuries is absolutely not true. And I challenge anyone to call me and give me the names of those. So when can I get my booster? I'm immunocompromised. Talk with your doc. You can get it tomorrow. What are the symptoms of long haulers? I don't hear a lot about it. Well, there's both good news and bad news on long haulers. The long haulers are people who have symptoms for a long time after they have COVID. Some people call it long haulers. Some people call it long COVID. And they're basically symptoms of COVID that don't get better. The most peculiar of these are loss of sense of smell and taste. And so most people who have COVID lose their sense of smell and taste, get it back in a few weeks. However, there are some people I know, who've had it, and 5-6 months later, they still can't taste anything, or even worse, everything tastes like something bad. So one of the guys I know said, everything tastes like mold. Ugh, that is my least favorite smells. Another people said everything tastes like it's burnt. Another person said everything tastes like it's like sucking on a penny. And so these symptoms happen. Well, loss of sense of smell and taste is annoying, but probably not serious. But the ones that are serious are people have this ongoing chest discomfort, a lot of cough. People have ongoing real fatigue. So people who used to be pretty active and whatever, was actually pretty active, now saying, look, I just can't do anything. I'm going to get up and do the dishes, and I have to sit down and rest. So that's what it is. We think about 20 to 30% of people are going to have those long haul symptoms. We think it's less in people who've been vaccinated. So is the vaccine fading with time, or is it the Delta variant? It's probably a combination of both. Delta variant is very clearly, though, the major contributor. I mean, in places that have a lot of Delta, they have a lot of disease. Places that don't have a lot of Delta, they don't have that much disease. So I think about 80% of it is the Delta, maybe 20% of it being the vaccine fading with time. So how does COVID cause blood clots? We don't really know. And do other viruses cause blood clots? Absolutely. So other germs cause blood clots. So MRSA, that people know about, so MRSA, which is a bacterial thing, when you get an infection, very clearly causes blood clots. And that actually, back in the time we worried a lot about MRSA, was one of the reasons that people died. So they would come in, they'd have a MRSA infection, you treat the infection, and yet they would die. And what you found is that they got a lot of clotting with it. So clotting does occur with certain illnesses, certainly some more than others, but COVID very clearly does. And so when people come into the hospital with COVID, they usually get treated with anticoagulants, low molecular weight heparin or aspirin, to go ahead and decrease the that. How come DPHN isn't calling new cases anymore? Well, we are. So the press releases come out on Monday, Wednesday, and Friday, where we're looking at cases all day and all night. So I meet with the team every morning at 8:30. They were up, I don't know, 10, 11 o'clock last night doing new cases and doing all the work they were doing. What's happening is the state system is really getting overwhelmed with this many cases, and so it's incredibly slow in the daytime. So stuff that should take just a few seconds is taking 5 or 10 minutes to do, and so it's so slow in the daytime that people are working all night to get these things in. So we're definitely calling new cases. Now, are we calling, so you have a new case and we're calling them, are we calling them as quickly as we did before? No. So sometimes a day or 2 or 3 out. And what's happening with so many cases, we have a lot of case reports that come in with a bad phone number. So I do some of these calls, and I did 6 the other day, and 2 of the 6 couldn't answer. One was a no answer, this phone is not in service, and then other people are leave a message, and then you get the voicemail is full. So it's pretty hard to get them. So we are trying to call. So if you're positive and you haven't gotten called, you can give us a call at the hotline and we'll get to you. However, most of the things they're going to tell you, we did a little video, I did it sitting here last week, early in the morning, and it talked about what you should do if you test positive. And pretty much that's what they're going to tell you. So if you want to watch the YouTube video, you'll get a heads up on what they're going to ask. So I know 3 people that are breakthrough cases. Why does it seem so common, but you're reporting it as rare? Yeah, this is a problem. So, because in some places, a bunch of breakthrough cases, and you think, oh, this isn't working. And then other times, you have a time when everybody's infected isn't a breakthrough. So we had one large workplace here where there were a lot of breakthrough cases, and these were prominent people, so people knew a lot of these people. But here was the story. Those people were all mild to moderately ill. None got hospitalized. None died. And so that's what you expect on breakthrough cases. If you're going to get them, you're not going to have very many. But the numbers don't lie. 60 of the last 917 cases, 68 were vaccinated, 849 were unvaccinated. There are some people who have lied about their vaccine status, believe it or not. I was vaccinated, I'm a breakthrough case. And then you look and there's no record of the vaccine. So some of it is hard to know. The other thing that seems to happen is that breakthrough cases seem to get clustered, like in that one workplace. But again, overall, the vaccine seems to be 85% protective in getting disease and over 90% protective in getting hospitalized. Now, if this were a disease where people got it, got over it, and nobody got hospitalized, the hospital did get full, not a lot of people died, you really wouldn't care very much about it. But with so many people in the hospital and so many people dying, especially young people, we really do need to respond. Yeah, so why do some people get so sick and then some people hardly get it at all? Well, this was one of the early, absolutely mysterious things that we saw. So the Diamond Princess is this ship. And it's a sort of high-end cruise ship. And they're doing a tour of Asia. One person gets on and is sick with COVID. They didn't know it at the time. And then over the next few weeks, like 800 people got it. It was just remarkable how many people got it from this one person in the beginning. And it was people on the ship, it was public health workers that came in. It was just stunning how many it spread. So they did a lot of lots of study. They found that maybe 30 or 40% of the people were asymptomatic, and many of these were older, rich people. So they were, not all of us could afford a cruise like that. And so 30 or 40% were either asymptomatic or just totally mildly symptomatic. A bunch were sicker, about 10% got hospitalized, and about 1 or 2% died. And so why did that happen, right? Why did some people do it? There's some thoughts. One of the thoughts is that it has to do with viral load. So if you get exposed at a place where the person is in your household group and you get a lot of virus, you may get a higher dose, and that could do it. But then there's this real difference in the way people respond to infections. And this is one of the things that we would hope to learn, but we don't. My daughter was vaccinated and when pregnant, and got the second when she was breastfeeding. How much protection does the baby have? The baby has some, but not as much as if the baby got vaccinated. Well, the baby can't get vaccinated, but some, because antibodies both go across the placenta, and the antibodies are also in the breast milk. What we do know is that moms who've been vaccinated tend to not get the disease and not pass it on to their babies. I don't think there's any cases where people in your situation where the babies got it. But this last week, we had an unvaccinated mom delivered a baby, 2 weeks old. The baby was in the hospital with COVID. So please, please, please get vaccinated. CDC has looked at all the studies, now strongly recommends vaccination for pregnant people. So our monoclonal antibody therapy is available. It's actually a polyclonal antibody, but yes, it is. It's the Regen COVID, and you can get that at Mercy or at the Evergreen. Thoughts on it? It works a little bit. So if you have post-exposure prophylaxis or early on, it helps a little bit. It's not great, but it helps a little bit. And since we don't have a lot else that helps a lot, it's probably okay to do. Again, it's so much better to have gotten the vaccine, but if for some reason you didn't get the vaccine or didn't have a good response to the vaccine, because maybe you've had a kidney transplant or heart transplant, then it's probably okay. So I've seen several fast food places are closed. Are they having outbreaks, and is that why they're closed? We haven't closed any restaurants. So we have not said to any restaurants you need to close. We haven't taken away anybody's thing. They have closed because they have so many people who are sick that they can't staff the place. So we have at least 3 that I know of that are closed because they have so many people who are sick that they can't do it. Actually, it's a smart thing to do. You've got a bunch of cases and the staff, close down for 2 weeks if you can. Let everybody get through it and then start over again. So in the early days when you're really contagious, can you show no symptoms? And yes, this is one of the terrible parts about this virus. About 18 hours before you show symptoms is the time you're maximally infective, and that's why. I mean, you have no symptoms, and you go to a party, you go to a cocktail party, you go there, and then you spread it. We think this is how it spread on the Diamond Princess. There's a very elegant study from Connecticut where there was a cocktail party, and there were a bunch of people at a cocktail party, and you know, cocktail parties, you sit around, talk with people, whatever. This guy then left the cocktail party and flew to South Africa. Long flight. He gets on the flight, he starts getting a little sick. In South Africa, he gets really sick. They test him, he's got COVID. He infected so many people at the cocktail party. And again, he had no symptoms when he was there. And we've seen that again, too, that people are really contagious before they get symptoms, but also really contagious in the first day or two. So if you're sick, please, please, please stay home. I cannot tell you how many people, how many of our outbreaks start with, oh yeah, Joe was sick for a few days. He just thought it was allergies, came to work, and now we're all sick. So my mom just finished radiation and chemo. Oof, can she get the vaccine? Yes, she can get the vaccine, and if she's already had 2 doses, she would be eligible for a 3rd dose. So how long should an unvaccinated person wait to get vaccinated after they come down with COVID? So if you have COVID, you need to wait until your isolation period is done. So that's 10 days plus your fever is gone and you're feeling better. But after that, get vaccinated. And again, the very best immunity out there is people who've had natural vaccine and then got vaccinated. How long? Okay, I'm confused. You can still get COVID after being vaccinated. You can die from the vaccine. I just don't see the reason to get vaccinated. This is all a matter of numbers. Okay, this is totally a matter of numbers. If you want to do it absolute, yes, you could get COVID and not have any symptoms at all. You could get COVID and die. You get the vaccine and be one of those incredibly rare people that has a bad outcome, or you could get protected. So you have to say, let's say we have 100,000 people in Douglas County who get the vaccine. It's pretty close. We've had 104 people die from the disease. About 47,000 people in Douglas County have gotten vaccinated. 0 have died from the vaccine. And again, my challenge is if you say, oh no, all these people died from the vaccine, you tell me. I mean, as a public health officer, I get to know about the deaths. There are no deaths from the vaccine. So again, 104 have died from the disease. None have died from the vaccine. And of the people who have died, yes, we have a few cases of people who've gotten vaccinated, have died after gotten vaccinated, but the number is very small. Almost all of those 104 who have died are unvaccinated. So again, it's all statistics. And if you want absolutes, like I'm only going to take the vaccine if it's 100% effective and absolutely no side effects, then you're living in a world that does not exist. Everything we do has some risks. I mean, a lot of people bring up the car analogy, and you're right. People still drive cars, even though we know that some people are going to die in car wrecks. But we have expensive roads that are made to be safe. We have all those state troopers out there giving you a ticket if you drive crazy or drive too fast. We have mandatory seatbelts. We have mandatory airbags. We have all those things to make it safer, and yet it's not 100%. And you can make it safer by not driving drunk, by not driving tired, not texting while you're driving, paying attention while you're driving. All of those things you can do to decrease it, but it's not 100%. And again, you say, I'm never going to get in the car because, let me do here. So if you say, you can still get COVID after vaccine, you can die from the vaccine. So the story is, you can still die in a car wreck even though you do everything. Why should I drive the car? Well, because you have to get somewhere. And so overwhelmingly, it's about 100-fold statistically in Douglas County, about 100-fold safer to get the vaccine than to not get the vaccine. Now, the other reason you're getting the vaccine is not just from you, is because if you get the disease, you can spread it to other people at work. They can then spread it to grandma at home who could die, or maybe a friend who's had a kidney transplant who could not make a good response. And so those of us who are otherwise really do need to get vaccinated. And again, you say you could die from the vaccine. Again, it's open season. You tell me the person in Douglas County who's died from the vaccine. I can tell you the 104 who died of COVID. So how many people do you think are asymptomatic vaccinated, just walking around spreading it? Very few. Very few. So very few. I mean, there are probably, so we know that people are asymptomatic. So there's two things. There's asymptomatic, which means you have the disease, but you don't have any symptoms. There are some of those. Remember, we talked about the Diamond Princess, maybe 30 or 40%. It's a little less with Delta, but just say it's 30% who have that. Those people have very low viral loads, so they're probably not spreading it very much. And so the asymptomatic vaccinated people probably not spreading it very much. Now, the people we do think are spreading it are people who are pre-symptomatic. No symptoms today, like the guy at the cocktail party, but symptoms tomorrow when he arrives in South Africa. Those people are there. There are some, but again, look at the numbers. 917 cases last week, 68 vaccinated, 849 unvaccinated. The numbers are stunning. So why is our natural immune system not fighting COVID? Well, it tries, but this is really a bad virus. The viral load increase, especially with the Delta virus, is enormous. So when you look at it, there's about 1,000 times more virus with the Delta variant than there was with the Alpha variant. And so it's just an overwhelming infection. So our bodies do very well at fighting infections that kind of creep up on us and then go away. Colds, sore throats, things like that. But things that go really fast, like the Delta variant, we're not very good at it. Next question is, does it matter which third shot I get if I'm immunocompromised? The recommendation is you get what you got if you got an mRNA vaccine, to get what you got the first time. However, you can switch. So both my husband and I are vaccinated. He tested positive and I tested negative. Good. We have a 3-year-old. How likely am I and the 3-year-old to get it? So in households among vaccinated people, you're still likely not to get it. And the 3-year-old, because the 3-year-old's not vaccinated, has a relatively high likelihood of getting it. So I would bet, if you had to be a betting person, it's your husband's going to get it, going to have a mild case. You, because you're vaccinated, will either get it or either not get it or get a mild case. And the 3-year-old is likely to get it and have a mild case because 3-year-olds usually have a mild disease. So can I explain the triage process at Mercy? I don't know. I don't know. They've done triage for many years where they look at people. If they're not critically ill, they try and see if they can be seen somewhere else. I don't think vaccine status impacts that, but you'd have to ask Mercy about that. So does the vaccine get processed by the kidneys? Not really. So, you could probably find some vaccine stuff in the kidneys, but I have stage 4 or 5 CKD. I'm sorry to hear that. And renal atrophy. Is it risky to get the vaccine? No, but it's really risky not to get the vaccine. So we do know that people who get the disease have lots of kidney injury. And so if you already have some kidney injury and some kidney damage, you really, really, really should get the vaccine. And we spoke with the people at DaVita today, and they have it. So get it. Well, so why are there more cases now than before the vaccine? Well, because the Delta variant is here. It's all about the Delta variant. Before the Delta variant, what you were seeing is a declining number of cases. And you remember in early July, we did not have very many. Cases. We were down to. We had a day where we just had 2, and so if you watched, basically I said, if we're going to stick with the Alpha variant, we've got this handled. However, my concern is other variants, and Delta has shown up, and Delta is nasty. And that's why there are more cases now than before the vaccine. Now, the other difference is, take this time last year, last July, a lot of things were closed. There wasn't a fair. There wasn't a music on the half shell. Restaurants were mostly closed. And so people didn't have a lot of the gathering that they have now. People were doing a lot of gathering. I drive through the streets and I see people in restaurants and people in bars, this is the kind of places that it spreads. So is it safe to bring my kids to a safe well child visit? Well child visits are great. I'm a pediatrician, so I've done tens of thousands probably of well child visits. And well child visits have all kinds of issues. I think during this really high tide, though, everybody should just try and stay home. And the reason being is that some of those kids who are going to be at the doctor's office are going to be sick, and they may not be using their masks well. So last Tuesday, I was in clinic, and the first 2 kids who came in for well child visits, we asked other questions. One was exposed to COVID, one had fever and a cough. We tested them, and they were both positive. So, we didn't think we exposed anybody else, but had you been sitting in the waiting room with those people, they could then have exposed you. So I think it's not unreasonable to hold off on well child visits for now, and that when the cases get under control, we're doing well. So is there anything we can do to help? That's very kind. Do you need volunteers? We're worried about the strain on you and your staff. Well, we have the most incredible staff. I mean, all this cases, all the stuff, work until 10 o'clock at night. Not a single complaint in the crowd. Now, we're a little cross about the state system, which is freaking slow and was down again today. So we're a little unhappy about that. But they've been great and great together, working nights and weekends to get this done. There may be some things you can do to help. If you can give us a call tomorrow. We just had a lot of phone calls, and so we might be able to use somebody to just answer phone calls and take messages. We've had our call center open every day since last March 13th. So it's been open for a very long time, and people have worked all nights and weekends taking these calls. And there are a lot of calls this week, as you can imagine. And so call Teresa and see if you can do that. All right, well, we're right at 7 o'clock. I think I answered all the questions. What I've left is, again, when people say, oh, all these people are unvaccinated or whatever, please ask them for the data. I mean, I could show you the data that the great majority of people hospitalized at Mercy are not vaccinated. Now, maybe this person was misunderstood, but it's not like the great majority of people at Mercy are vaccinated. The other thing is, people are talking about all the people hospitalized and dying from vaccine complications. Give me the names. You remember early on there have been a bunch of things, and I've asked people to actually, give me the specifics and we'll track them down. And we haven't been able to do that. You remember early on there was this thing, this internet thing going around that people were getting notes that they were tested positive when they never even got tested. All these people sent me, oh yeah, I know, but this happened to my brother's sister or whatever. And I would call the brother's sister and they said, well, it didn't really happen to me, but I heard about it on the internet. So it's really hard to pin these things down, but we'll try. So we'll do that. But really what we're asking now is for people to take it on themselves. I mean, the government doesn't need to do closures and mandates and whatever, but you as an individual who has a choice should think about what's happened in the community. If Mercy says, look, we can take no more patients, that affects every single one of us in a really negative way. In my family, people have needed the hospital care. People have needed ICU care. And if the hospital said, sorry, we have no more ICU beds, you have to take care of this at home, it's going to be awful. So please do the things that we can do to bring down the spread. And there's 4. The first is avoid crowded indoor spaces. I mean, outdoor is still pretty safe, but avoid crowded indoor spaces, restaurant, bars, and whatever. You need to be careful about those. The second is if you're sick, please stay home. Again, I cannot tell you the number of outbreaks that we started when somebody who was sick went to work. The third is I think masks do help, and please wear a mask when you're indoors in a crowded space. And then the fourth is get a vaccine. It is so clear to me that the vaccine works, that the vaccine is safe, not 100% safe, not 100% effective, but pretty dang good. And so please think about getting a vaccine. And we're going to get through this. But I think the worst times are ahead of us. These 250 or 300 people who are positive today, about 8% of them are going to require hospital care in 8 days. And I really, truly hope that we have a place to put them in the hospital when they need it. And far and above everything, and we're asking people to be safe and be kind. Thank you.